Welcome to Bookie Talks Breastfeeding.
Breast milk will come in different colors, which ranges from white to yellow, to green, to light blue, to brown, to even black. The color of a woman's breast milk does not necessarily signify that the breast milk is bad. The color of a woman's breast milk could be an index into the kind of diet the woman is on. And also, it could depict that there's an issue going on with a woman's breast that needs to be addressed by a healthcare provider. The types of breast milk that we're all acquainted with are three, and they include the colostrum, the transitional milk, and the matured milk. These kinds of breast milk are produced to meet specific dietary needs and immunologic needs of an infant. And the variation in the components of these individual types of breast milk is what distinguishes them apart from each other. I'll start off with the colostrum. Colostrum is the first milk that is produced, and its production begins as early as the 16th week of gestation. When a woman delivers a baby and the baby begins to nurse, the first milk that the baby gets is the colostrum. Sometimes a woman can begin to produce colostrum, and of course you could see it coming out of her breast weeks before the baby is delivered. The colostrum is thick, it is sticky, it is rich in a lot of immunologic factors, and that is why it is often referred to as the baby's first immunization. You can refer to my video on colostrum for more details. The colostrum is not copious because it doesn't have a lot of water, but the quantity of colostrum that is produced is perfect for the baby's gentle and small belly at delivery. The colostrum often comes off as yellowish in color, but sometimes it is not uncommon to find colostrum that is whitish in color. This is the colostrum. The next kind of milk that I'll be talking about is going to be the transitional milk. The transitional milk's production begins from day 2 and it can be up to day 5 postpartum. The transitional milk is copious and it is produced when a woman starts to feel engorged, when her breasts are full and sometimes the breasts are leaky. That is the transitional milk, and once expressed, it is water rich, so that is why I often call it the fat-free or the skim milk of breast milk. The transitional milk, once expressed, could give a blue hue in color, and that blue hue disappears, with exposure to a room air. And the transitional milk proceeds further after a couple of days to what we call the matured milk. And the matured milk is what we all know, and that is what sustains the baby till the baby weans. We have the matured milk presents in two forms. We have the fore milk and we also have the hind milk. The fore milk is rich in water, just like transitional milk. It is very copious. It is what is first produced when the baby starts to nurse, when there is a letdown, and I call it the thirst quencher. This is what the fore milk looks like. The hind milk is what is behind all those fore milk. So that is why we always encourage babies to stay on that breast and nurse, get out the fore milk and get the fat, rich, creamy, sweet hind milk out of the breast. This is what makes the baby laden up on all those nice little fats that makes the cheeks chubby that we love to play with. This is the hind milk. When milk is expressed from the breast and is left to stay in a refrigerator, the milk separates into two components. We have the hind milk on the top, and we also have the fore milk below. This is unique to breast milk. Cow's milk does not separate into two components. When milk is frozen, the hind milk components of the breast milk, because of its fat content, could turn yellow in color. And of course, once it's brought out of the freezer and it stores, it goes back to this original color. So in that situation where the fat components of the hind milk freezes, you see breast milk come off as yellow. Now I'll be talking about dark yellow to orange breast milk. Breast milk can come off as dark yellow or orange if mommy consumes a lot of foods that are rich in beta carotenes. Such foods include carrots, squash, even cantaloupes. Now, I cannot say specifically how much cantaloupes or carrot or squash a mom needs to eat to have yellow or dark yellow breast milk. I think it's going to vary from mother to mother. But in such situations where mothers consume a diet rich in foods rich in beta carotene, we have the mom's expressed breast milk come off as yellowish or dark orange in color. And like I said earlier, when breast milk is frozen, the hind milk component of the breast milk can come off as yellow because of its rich fat content. Green breast milk. Green breast milk is often found when mothers consume foods that are rich in greens, green vegetables. So for those mothers that love their big bowls of salads that are rich in kales and collard greens, they love their green smoothies, they love their seaweed as snacks, it is not uncommon to find the expressed breast milk green in color. Other ways that mothers could have green breast milk include if they consume a lot of green herbs, and also if they eat a lot of foods rich in green dyes, they will most likely produce some breast milk that is green in color around the time when they eat those green foods. Pink breast milk is often produced when there's like a little burst in a capillary supplying blood to the milk ducts. So pink breast milk is just, little bits of blood leaking into the milk duct, and it will allow the breast milk to come off as light pink or a little deep pink in color. And this could occur in the presence of a rupture in the, like an issue with the nipple. It could be a cracked nipple, or it could even occur in the absence of a cracked nipple. Things like anything that will apply deep pressure or lots of pressure on the breast could cause a capillary to burst, and such things could allow the the breast milk, expressed breast milk, to come off as pinkish in color. So even pumping, excessive pumping or aggressive pumping could be one of those things that could cause pink breast milk. Even heavy suctioning by some babies, continuous suctioning, also can rupture some capillaries, because remember, the capillaries are very tiny blood vessels, so any little force or pressure could rupture them. Also, when breast milk is expressed and left out on a table, the colonization of that breast milk by bacteria called Serratia could also allow the breast milk to turn pink. And in this instance, that is bad breast milk. So if breast milk is pink coming out of the breast, it's okay and safe for the child to consume. But if breast milk is expressed and turns pink after expression, it will likely be because of a bacterial contamination, and that is not fit to be consumed by the baby. The mom will have to talk to the pediatrician, also have to talk to a healthcare provider. So probably they'll be carrying out a test on the breast milk, and of course maybe they'll be giving some medication. So that's my advice on that. Brown breast milk will occur when there's bleeding into the milk ducts. Now, bleeding this time around, I'm talking of heavier bleeding, which is more than the capillary bleeding, and this may look brown, it may look dark orange, it may look rusty colored. And when I mean rusty, I mean like a brown oxidized pipe color, and it is more associated with more bleeding, associated with which can be associated with breast conditions like mastitis or nipple fissures. Of course, I'm not going to be talking about mastitis and nipple fissures here, but just know that when a breast milk comes out brown, I think it talks about more serious business going on with that breast, and it needs to be addressed by the primary care provider. Now, breast milk can be black. Yes, black breast milk. Black breast milk often occurs when a mother is on a medication called minocycline. Minocycline is a form of tetracycline, which is an antibiotic and can be used to treat various ailments ranging from acne, which of course acne is common, even urinary tract infections, and a host of other infections. One of the major effects of minocycline is darkening of the urine. It could cause dizziness, it could cause nausea and vomiting. And also one major side effect of minocycline, apart from dark breast milk in breastfeeding mothers, is the discoloration, or rather the yellowness of the child's teeth and also the bones. And that is why minocycline and some other forms of tetracyclines are not recommended for children under 8 years old. So now we've talked about all the various kinds of breast milk. So like I said earlier, colored breast milk does not depict bad breast milk. It just means that the mom is eating a variety of foods that might be very, very healthy for her. But sometimes colored breast milk could be an index as to the mom's state of health, or rather, colored breast milk could be an index as to what is really going on with the mother's breast that will need to be addressed by a primary care provider. Thank you.